My name is Dr. Madeline Van de Capelle, and I am a family medicine physician with Goshen Physicians. An annual exam is a yearly exam that you come in and you can expect to go through things like overall well-being, so assessing things like your mental health, are you following a well-balanced diet, exercise, but also doing things that involve preventative screenings. Are you due for your mammogram, pap smears, colonoscopy, those kinds of things. If you've done previous lab work, to maybe review that, or if you haven't yet done your labs, to get those set up and scheduled to do. Talk about vaccines, and then also do a general head-to-toe exam and make sure everything's looking good. I would want patients to understand that the goal of a yearly or annual exam is talking about preventative measures, briefly touch on chronic medical conditions, but in general, we shouldn't be talking about any acute or new problems. An acute visit would be any new concern that's maybe been going on anywhere from 6 weeks to 4 weeks to the last week. Those could be, I have a pain in my back, I have a cold, cough, sore throat, those kinds of things. The goal of coming in to see your provider is sometimes there, one, are things that are missed. Two, we can also sometimes talk about things and maybe they don't realize something is going on. For instance, I deal a lot with mental health and depression, anxiety, and sometimes patients don't really realize something is going on until we kind of divulge more into it and talk about it more. Another thing, for instance, lab work. A lot of illnesses are silent. People don't know that they are suffering from something, and we can really diagnose them by their blood work. For instance, chronic kidney disease, high cholesterol, fatty liver, diabetes. A lot of times it's kind of a slow developing thing and people don't realize that they are either pre-diabetic or diabetic. Some patients might fear that coming into an annual exam is just going to leave them with a long list of things they should be doing and that they're not doing and feeling some sort of judgment. And that's not at all the case. Our goal as family physicians is to provide patients with the information and the education, but to work with them to overcome any barriers that they might be having or challenges. We're always in their corner. Our whole goal is to guide them towards a healthier lifestyle, but collaboratively, and we're going to meet them where they are. I would encourage you to find a family physician if you don't have one already and complete your annual exam.